Ambulance driver Manoj Kumar is on COVID-19 duty in the Indian capital, New Delhi. During the coronavirus pandemic, he says he's had to work 48-hour shifts because the Indian healthcare system is underfunded and overstretched. His family wants him to quit and return to their village. He's not ready to do that yet, but he does feel badly let down by his government.
The government or its representatives should come and see our working conditions. They should at least try to talk to us. No one comes to meet us or ask us about our issues. If we raise our voice about this, we are fired from our jobs or transferred to a different zone.
India's official tally of coronavirus cases is now past 5.6 million, second only to the United States. India's Supreme Court says conditions are deplorable for patients in the worst affected states. Doctors and nurses have been protesting against their working conditions, and some have threatened to resign.
There are no guidelines on how long healthcare staff should wear personal protective equipment. The government's healthcare policy doesn't even mention the role of nurses. And it's really sad the government denied having any data on how many healthcare workers have died of COVID-19 while performing their duties.
Over the past 6 months, a dire picture has emerged of how the world's second most populous nation is coping with the pandemic. Opposition MPs say the government's confused messaging hasn't helped.
When we had 200, 300 cases, we went for one of the most stringent lockdown all over the world. Now when we are reaching 1 lakh cases per day, we are opening up. I don't understand the pattern.
But the government says people must learn to live with this virus because the cost of the lockdown with 120 million people jobless is too high to pay. Prime Minister Narendra Modi is working with state leaders to tackle the crisis. Public health experts say it's the best way forward.
India's response has been under the National Disaster Management Act. We did centralize decisions, which comes with its advantages and disadvantages. But the learning all over the world is that we have data locally, that we analyze data locally, and we empower it locally.
Modi has praised his government's handling of the outbreak, but with cases rising once again, the public may view things differently. Victoria Gate.